Hello, my name is Dr. Sahabi from California Dental Group. You know, I'm often asked, what is periodontal disease? Now, the common name for periodontal disease is gum disease. Now, gum disease is so common, 3 out of 4 people have gum disease. Now, I have a video that I want to show you that explains these issues. Now, this is a tooth that you can see. This is the tooth, the gum, and the bone. So gum infection, it involves the tooth, the gum, and the bone. Now, with time, plaque accumulates on the tooth. Sometimes you don't see the plaque. It's just, you see the yellow sticky stuff on the tooth that it's not sometimes visible to the eyes. But if we use disclosing tablet, you can visualize that. Now, this is what we see every day. This is what we need to make sure it cleans up every day. Now, if that plaque stays on the tooth, it starts infecting the gum, and that bacteria produces toxins. In combination with your body's reaction, it starts to dissolve the bone and the gum surrounding the tooth. That's the number 1 reason why people lose their tooth. And it becomes a problem. Now, what we need to do, what are the symptoms of periodontal disease or gum disease? Now, if you have bad breath, bleeding gums, which is very common, swollen tender gums, gums pulling away from teeth, and loose teeth, of course, at the end. Now, this is an example of a healthy gum. Now, you see there is no swelling. Now, this is an example of early gum disease, and this is an example of moderate gum disease. You can see the gum is changing, swelling. If you touch this gum, it starts to bleed. Now, every time you have bleeding, that means your gum is infected. So a bleeding is a sign of infection. Now, sometimes none of these issues hurt, and you go along your day as if it's nothing is going on. But there is some concerns that you need to be concerned about. Now, the first thing that we need to do is to measure what's the space between your gum and the tooth. Now, that space, if it's 3 millimeter, it's healthy. If it's more than 3 millimeter, it's an indication of disease. So sometimes if it's 4 millimeter, that means there is some issues that you need to be concerned about. If you get bleeding, that's another issue that we need to be concerned about. Now, the second thing that we do after we do the measurement is we take x-rays. Now, these x-rays, this is a healthy bone level. Now, if we have periodontal disease at the later stages, you can see how much bone loss we have. Now, this may not be apparent when we look at inside your mouth, but we have to take some pictures. Now, this is another reason why we take x-rays. If you see that circle, that's where the tartar buildup causes a lot of damage. That's where we need to remove the tartar buildup. Of course, you will work with the hygienist, you will work with your dentist to make sure you do a proper job of keeping that bacteria out of your mouth. Now, there is a bacteria that causes periodontal disease, and our goal is to remove or reduce the number of the bacteria that cause the gum disease. Now, there are many reasons why we get gum disease. One of the reasons, of course, is if we don't brush and floss. Second reason is if we have crooked teeth, if we have spaces in between teeth. So all of those reasons need to be corrected before we can eliminate the gum disease. I appreciate your attention. We have more videos like these on our website. And again, I'll see you later.